Welcome back to the OHSU Effect. I'm Lacey Evans. So many of us live in the Northwest because we love it here, but this is the time of year that we don't really love. Sometimes people can get pretty down, and yes, you can blame it on the weather. With me now on the OHSU Effect is Dr. Al Louie, a professor of psychiatry at OHSU. Good morning.
Good morning.
So you discovered winter depression. First of all, what is that? What causes it?
Winter depression is caused by the short days of winter because it throws your body clock out of line.
Pretty simple. So how is a person diagnosed?
Well, in addition to the normal symptoms of depression, somewhat more mild than the non-seasonal depression, these people sleep longer in the winter, but despite the longer sleep, are fatigued all day long, have trouble waking up in the morning, many of them. They prefer complex carbohydrate-containing foods and have a greater appetite, and therefore they gain weight in the winter, which they'll lose in the summer. But the key is that they always get better in the spring and summer. So they'll have a history of a few years of getting depressed in the fall and winter and coming out of it spontaneously in the spring and summer.
So is that kind of the tipping point where people should seek medical help, or what do you suggest there?
Well, the treatment of choice is light, and in order to sit in front of a light fixture for, well, eventually you can cut it down to 20 or 30 minutes a day. It's still a bit of a chore. So the tipping point is it worth sitting in front of a light fixture for 20 to 30 minutes every morning as soon as you wake up in the morning for most people to compensate the distress of having the symptoms? That's the tipping point. Which is worse?
Yeah.
Because it's a pain to sit in front of a light fixture.
Well, and I've seen those lights. They are bright. And for myself, just the average person, I was really shocked, and I thought, wow, I couldn't do that.
Well, most patients don't complain about the brightness. It's just they're just tethered to that spot every morning. You know, they like to be able to move around. So if they're willing to sit down for 20 to 30 minutes in a one seat, then they can treat their depression, even if it's mild symptoms.
Is there a genetic component here?
There is a genetic component, and we know that because it runs in families and in females. So if you have it, your mom probably had it, and your aunt probably had it.
I would assume that there are more cases here in the Northwest because of our weather.
There are more cases in the Northwest, but it's not because of the cloudy days or rainy days. It's because of the fact that we are at 45 degrees latitude, which means the winter days are very short.
I see. Okay. Now, we talked about light therapy. You're kind of the father of light therapy, but what are the other current treatments?
Well, we're experimenting with melatonin. I'll talk about that in a minute. But if you like to take pills, antidepressants, standard antidepressants for non-seasonal depression also work. The melatonin is still experimental. We don't want people to get sleepy during the day, so we cut the dose down way lower than what people take at night to help them sleep. And you need it usually in the afternoon. Some people need it in the morning, and you won't know unless you test it on yourself and see. Just like with the light, it's usually as soon as you wake up in the morning, but if it doesn't work, then you need to switch it to the evening because the body clock can shift in two directions, and for some people, they get depressed because it's shifted too late and with the later dawn, and for other people, a smaller group, it's shifted too earlier with the earlier dusk of winter.
So it sounds like you really kind of trial and error in the beginning.
Yes. Well, we're coming up with a lab test, but it won't be ready for a year or two. And until then, it's trial and error, yeah.
So what is the difference between winter depression and just a regular depression, for lack of a better term? How would we know if we're suffering from one or the other?
The main way to know is that you've had it for at least 2 years in the winter and it's gone away on its own in the spring. That's really the main way that you know it. Now, there is some interesting news that we're working on now in our newest research, and that is that non-seasonal depression may also have a component related to the body clock. And if we can prove that, then we'll be able to use light and or melatonin to treat non-seasonal depression, which is far more common and usually more serious than winter depression.
Well, talk about seasonal affective disorder. We hear that a lot. Is that the same thing as winter depression?
It is.
Okay. Well, tell us more about your research in that area.
Well, the first research was done more than 30 years ago, where my research team and I, when we were at the NIH, treated the first patient with winter depression, and the first use of white light therapy for that, bright light. It has to be brighter than ordinary intensity indoor light, not as bright as sunlight. But that's why people use the portable light fixture, because the distance your eyes are from the light fixture controls the amount of intensity that you have. So anybody who has a light fixture should know the distance their eyes should be from the fixture. You keep your eyes open. You don't stare at the fixture. Usually you position it at a 45-degree angle. You scan your eyes across it for a few seconds, several times a minute for 1 to 2 hours. As soon as you wake up, it has to be as soon as you wake up in the morning. And then you can cut it down to 20 or 30 minutes. As the days are now getting a little bit longer, and if you're lucky enough to be able to sleep late, you can just use sunlight. Don't look directly at the sun, of course, but going outdoors immediately upon awakening will be the best treatment for you.
Why immediately upon awakening?
Because you want to synchronize the light signal with your wake time.
Okay. So you talked about a lab test, but any other new treatments on the frontier?
Well, the melatonin will be a new treatment, and it's pennies a pill.
Well, let's talk more about that.
And it's a lot easier to use than light.
Yeah.
So that may replace all the current treatments.
But I think that we wouldn't think of melatonin because that puts us to sleep. So, yeah, explain how it works.
It's a bit ironic. In fact, some of my colleagues not only thought my research was not going to lead anywhere, they thought it was exactly opposite. They thought that melatonin would make you worse. But we've discovered, and we published this in a paper called the journal was the Proceedings of the National Academy of Sciences, a very good scientific journal in 2006, that very, very low doses, lower than 0.3 to 0.5 milligrams, which are hard to get in the store, will help people with depression. Most of them need to take it in the late afternoon. Some take it in the morning. And, of course, you shouldn't drive right afterwards if it makes you sleepy.
And you're also using this with the blind.
That's right. We are currently treating a lot of and researching a lot of blind people. They're the totally blind. They represent about 15% of those who are denied driver's licenses because of their eyesight, and they have no light perception. And almost all of these people drift, usually later each day, because their body clocks cannot synchronize to the light-dark cycle. And we've discovered that melatonin, low-dose melatonin, taken usually around 6 in the evening for them, treats about 100% of them.
And so that kind of sounds like it puts their body clock back in sync with the day.
It does.
Okay.
That's the problem. It's winter depression and the problems of blindness, which occur year-round, but recurrently as they go in and out of phase. It's like having jet lag.
Okay. Well, are there other health disorders where our body clocks are at fault?
We're not doing so much of this research, but my colleagues at universities around the world are studying heart disease and diabetes, among other problems. And, of course, we have daylight savings going on off of that. We call Monday morning blues, where body clocks get a little messed up during the weekend. We have shift work problems. Of course, there's jet lag, and when you travel east or west through many time zones. So all those are body clock disorders that can be treated with appropriately timed bright light exposure or avoiding sunlight at certain times, and low-dose melatonin.
And so we hear about a lot of these things like daylight savings or shift work, and we just think that people would have problems with sleeping, but it could lead to depression and other things, right?
Well, I'm glad you mentioned sleeping, because sleep is a big factor in a lot of disorders, not just depression. Of course, it's huge in depression and in mania, where people don't sleep. So one way to use melatonin, about a third of us get sleepy on high doses at bedtime, and that will help people sleep better, fine. In other ways, we can help people sleep better by adjusting their body clocks with light or low-dose melatonin during the day, depending on the disorder. There are extreme owls and extreme larks that we also treat with light and melatonin.
Any good websites that you would recommend to people if they are interested, if they think that maybe they have this and want to look into some treatments?
Well, the society that I actually was the founding president of that has the most comprehensive website is www.sltbr.org. OHSU.org, and I think OHSU also has a website.
Great. And of course, all these links will be on the OHSU Effect page, which you can find at kxl.com. Dr. Al Louie, professor of psychiatry, you discovered winter depression. He's the father of light therapy. Lots of great work in this field. Thank you for being with us.
Thank you.
And more of the OHSU Effect is coming up next. In 5 minutes, we're going to talk about a common fear for kids, the dentist. We'll find out how to make them comfortable.